Hi, my name is Kim Gerke. I'm a nurse that works with terminally ill patients in a hospice setting, and I would like today to talk with you about the psychological impact of working with patients who are approaching death. I would like to cover the areas of stages of grieving in end-of-life care as described by Elizabeth Kubler-Ross in her writings. The first stage of grief that person will go through or may start with is denial. This is where the patient goes through stating that the doctor must have made a mistake, it can't be me. Right, you don't want to feed into that denial, you just want to let the patient and the family go through that. That's part of their grieving process. Just be an active listener during that part and let them communicate and let them know that you're there for them. The next stage that Kubler-Ross speaks of is anger. Oftentimes you will see the patient expressing their anger towards the caregiver. Do not take this personally. Again, this is anger that is meant towards the person's disease or illness, and again, oftentimes is projected outwardly towards the caregiver. Again, be an active listener, offer comfort and support to the patient and family as they go through this area. The next stage is bargaining. As Kubler-Ross states, is the patient may say something to the effect of, if I could only make it to see my next grandchild, or if I could just make it till Christmas, then I would be ready to die. That's a normal process. They're trying to associate that they'll be ready after a major event in their life. Again, be a supportive listener, offer comfort and reassurance that you're there for them. Depression. This is a key state that a patient and family go through. They may become very quiet and may become very introverted. They're working through issues in their head, and it's a positive sign that they are working towards acceptance of their illness. Again, continue to be supportive, accept their active silence, and know that it's okay for you to be quiet also. Don't feel that you need to fill in the gaps when there is a big area of quietness. And finally, the area of acceptance is where the person is at the area where they know that the diagnosis is correct, they're facing the facts, and death has now become a reality. It doesn't necessarily mean that they are any more prepared for it, but they are accepting of that response. What I would like to reinforce to you is that people do not go through these stages as depicted in the book or by what I'm saying. They can fluctuate going back and forth. The important thing to remember is that everyone grieves in a different way, and we just need to be respectful of where they're at and where we are at during that process. What I would like for you now to do is to view a conversation that I had with 3 healthcare assistants who are currently working in the area of people who are terminally ill and are sharing experiences with you that they have had with patients that have died and what their reaction was to that. I've invited 3 nursing assistants to come and share some of their experiences that they've had with caring for patients in a nursing home setting regarding death and dying issues and how they handle the effects of that, both in their personal lives and their professional. If you would please introduce yourself.
Hi, my name is Cindy.
Hi, my name is Linda.
And I'm Yvonne. And we'd like to I do have some questions here just to kind of help guide us, but we'd like to just kind of have a conversation about certain things that we do. The first thing that I would ask you is how do you separate your personal beliefs and feelings towards death with those of your patients?
We try to respect their beliefs and put our beliefs aside to let them know that we're there for them, and whatever their wishes are, if they would like to see a chaplain at the time, or if they would just rather be left alone, that we're there for them.
Many times families will ask you direct questions about religious things, such as the difference between heaven and hell and their beliefs, and how do you handle things like that, and their fears of their loved one having pain, and that what do you find is a helpful response or what do you say to them, or do you find someone else to help you through that, to guide you? Because again, there really is no right answer to a family, but there's a lot that they're asking there in that one little question.
Right. We let them know that there's a chaplain always available. We do have a list of chaplains, and also that hospice is available for any other, like, pain medications that they may need, and that we're there to try to comfort their pain.
Have you ever had anyone ask you when someone's been appearing like they're sleeping, like a lot of families will say they look as though they're in a coma. How do you know if they're having pain? What do you find helpful to tell them, and has staff told you, your supervisors or nurses told you what things to look for that you can help share with the family so that they can look for if that person's not verbal?
If the patient is restless, we know that there must be some pain or some discomfort. So then we go and talk to our charge nurse, and we let them know. As far as heaven and hell, I think what I do is I talk as positive as I can and try to stay away from every negative, and hell is a negative, so.
Could you give an experience of something positive that you might say to someone when they ask that?
We just had one resident pass away, and she was very restless. She was afraid, and she asked what was going to happen, and I told her that it was time for her to go dance with the angels, and she just held my hand. And I said that because she was holding a rosary, so I knew that this was her belief.
Mm-hmm.
And you know, there's a Bible next to her bed.
Excellent. Those are very good things to cue in on that a lot of people don't know that we look at when we're in the rooms. Just knowing their religious background is of great help,
Right.
and not to just assume that everyone believes in heaven and hell. A lot of times my response will be to families, you just need to go with what's in your heart, and if you feel comfort in knowing that that person is going on to a better place, then none of us truly know, what happens after someone dies. But if we know that we can help them along the way be more comfortable, that I find that has been very helpful for me with helping the family.
And just reading the Bible to them is comforting. Reading, ask them if you can read the Bible and something like that, and that's very comforting to them.
Right. And again, that goes back to on admission with their religious beliefs that are shared with you. That's very important. And again, we may not be of the same religion, and I went out of my way to learn the rosary because we do care for many Catholics, and I've found that I've learned a lot from my patients and their families also by just exploring their beliefs. Thank you for that. Where or from whom do you receive the most support while caring for the terminally ill patients? Say here rather than at home.
Your co-workers, your supervisors.
I think, and we all work pretty much, it's very important that you work as a team, because that way then you can express your feelings much, much more easier, and, understand them, for somebody else who may not be able to take the death as easy as maybe I could, and so it's very important that you work together as a team and that you approach it as a team.
Is there any kind of organized support here for you, like offered through the chaplain or support groups once a month, or is that something that's not been needed here?
It hasn't been needed. I think because we're a smaller facility, we are more closer as employees too, and we pretty much give each other support. When she first started, you cried, but we gave her a hug, and that's okay. You gotta let it out.
And it was really hard for me to deal with the first time I dealt with a resident passing away, and Cindy came and told me, just think of it as a blessing because there's no more pain. And the patient is dancing with the angels, so.
That's great that you have that camaraderie. And back to hugging, I just wanted to step back just a little bit. Have you ever found a family to be resistant to that? I know that where I work, it's one of the first things that I ask, and I let the families know. I let them know that I'm a very touchy, hands-on kind of person, but I don't want to, again, put my feelings or beliefs on someone else this individual may be someone who's gone through their life who's not wanted to be touched or
Not
hugged.
as warm and open
Right.
to
And
hugs and...
exactly. And I've had residents tell me that they don't prefer hugs, but they, as the end gets near, they would like to have someone sitting in there just holding their
Holding their
hand.
hand. Holding their hand.
So touch does play in there.
Right.
You always ask, before you give a hug, you don't just...
Right.
Yeah,
We-
you
right.
But it looks like you need a hug, can I give you a
and
hug?
give them a
Right,
chance to
exactly,
respond.
exactly, great. Yeah, because I'm just one of those that would just jump up and, but I've had to
Right.
learn through my patients and their families too that I can't always do that.
Right.
That's my feeling, that's not where they're at that time. How do you handle showing your emotions, or do you show your emotions in front of family and patients? If someone has just died, do you feel comfortable showing your
Oh,
emotions?
sure.
Yes.
Yes.
We cry with the family, and show, try to...
Because
there
actually we
for them.
bonded with these residents. I mean, we have some that were here 3-4 years, and to me it's just natural to cry.
Right.
Right.
That's just, they're kind of like your extended family.
Right. And that does show that you're human, and that
You have
is
compassion.
extending to the family that they know that their loved one was well cared for. If you are feeling the urge to cry, that's showing that you truly were attached. It just wasn't something mechanical that you were going through.
We also have something where we call it a reflection sheet that we have started up here about a couple months ago, and that is where we, after the resident has deceased, we do show that different things we remember about that certain person, and then we send it along with the family. And that, for instance, if they smiled a lot, or different kinds of things that we write down for them, so they also know the closeness we have. And
That's great. And do you keep anything here if you want to do any reflection? I know that we had just recently started a journal where we put patients' first names but not last names, and just little tidbits. Anybody can go into that book that's worked with these people and just write a fond little memory of something that they had done, or they can log it as they're going along, through the journey, that so-and-so visited today. And I mean, there were times I remember sitting there thinking, I wish I had a Polaroid camera that I could have taken a picture of this and handed it to the family. What a wonderful thing that would have been. And then we have our journal to go back to, because we do have family members, and maybe you could tell me if you have people who come back here. A lot of families will come back on the anniversary date of the death of their loved one, just to see who's still working there, and to really want to connect with that person again.
right.
And sometimes it's hard when you deal with a lot of different patients to try to remember, but if you have that book to go back to and you see that name, it's going to click.
Click right away.
Right.
Correct.
Something about them, their special smile, or...
And we do have family members that continue to come back. We have one family member who comes back and plays the accordion, every first Tuesday of the month for the other residents here. And her mother passed away this last winter, so she still continues to come back. And we have others that, volunteer for different things.
For activities and come back.
Great. Okay. For patients that you've gotten very close to, we've kind of touched on this a little bit. How do you bring closure to with their death? Do you attend funerals? Or?
Yes.
Attend funerals,
I
maybe
do obituary, put it in my Bible.
Some family members would, give you just a little remembrance of, just a little something, for them, and going back to the reflection sheets, then that's another way of closure.
Excellent. Do you send sympathy cards out, or is there like a bereavement person that kind of handles that?
Well, generally, the social worker would send like a plant
Or flowers
to the funeral home, and then we always put up in our break rooms. We have the date and time of the funeral services.
Great. So they do encourage
Oh,
you.
yes, yes, to go to
Excellent.
funerals, yes. That's good closure.
What kind of things do you do to help balance your home life with your life here? I know I always call it my second home.
Yeah.
Home away from home.
Right, and mine is meant in a very good way. I enjoy going to work every day.
Right.
I get up and I view the sunrise on my way to work, and that for me is a piece, a calming piece. I don't know what had happened at work during the night, but I start each day with kind of a meditation in my car on the way to work, and just thanking God that I have the wonderful job that I have and I'm able to touch people's lives the way I have. If you can give me some ideas of what you kind of do too.
I think when you're in a job like this, it's hard for your family, your personal family, not to get involved somehow or some way, because you're always going home with stories.
Right.
You're always going home with something that happened interesting. And even when it comes to where the death is, you know, you kind of share that with your family, and so they know then that, you know, and like that how it affects you. So it's very, very important that your family, you know, understands that maybe you're not going to be, you know, in the uppiest mood when you come home because you just experienced a death and that. And so I think, you know, I know in my personal life, my family's involved, and I know just talking with all my other coworkers how much they are involved.
I think if you're spiritually know, or I feel there is life after death, and I think that's helpful. I don't know, I can't believe people can be in this kind of line of work and not believe in that. I think it would be very tough. So spiritually, it helps me. And taking a walk, if you have a bad day or you lost a resident that day, just taking a walk, and that's very relaxing for me. And
my family is very supportive. My children tell me to say hi to some of the residents because they come up and visit.
Right, yeah.
My husband, they're just there for me. And if I ever need to cry with them.
That's excellent, and that kind of goes back to what you were saying about, you know,
Right.
how your family, in this kind of work, it's hard for them not to become involved. I have a 16-year-old son that, he's my only child, and I share everything with him. We're very close, and I share stories with him and my husband. And it's the point now where I can walk in the house, and my son can just tell by looking at me. I'll walk in the door, and he says, "Mom, you've had a rough day. I can tell something's touched you. You need a hug." And he comes up to me and gives a hug. And so I know that everyone that I've cared for has not only touched me, but they've touched my family too by stories that I've shared. And having teenagers, it's hard to find a teenage young man anyway I think that would be, you know, that can be that intuitive and know what his mom needs. And sometimes it is just a hug without saying anything. So that's great. And being able to separate, you know, again, like I said, my separation is the travel time to work or home from work. And some people may think it sounds goofy, but one of the things that I do too is if I've had a very close connection with someone is sometimes I'll just say, if you are in a better place, can you give me a sign or something.
Right.
And as they're dying, I'm very aware of if I'm in the room with them and a family member's there. We normally will play soft music or something that the person had liked. And just recently I had someone who did die, and it was a brother-sister. And the brother was staying with the sister during the time. He called me in the room, and the radio was going very softly. And when I went in the room, he said, "Kim, I have to step out for a minute." And she was actively dying, taking her last breaths. And I paid very close attention to what was on the radio. And then he walked back in the room, shook his sister's leg, and said, "It's okay, you can go." And at the very last beat of that song, her heart stopped.
Oh.
And I just looked up at him and I said, "Did you ever know that you were her hero?" And the song on the radio was "Wind Beneath My Wings." And it just fit so perfectly with what had gone on. And he had been there for her the whole time. And those kind of stories, I just feel so, that gives me closure to know that I was part of that.
Right,
I
right.
feel very honored that I was in the presence of that person when they took their last breaths, knowing that they were comfortable. And I take that home and share it and become emotional. Frequently, I find myself saying, as well as others, that being in the line of work I'm in has really changed my life. Have you found yourself saying that to anyone? And if you have, why do you feel it's changed your life, or how has it changed your life?
I used to be so afraid of dying, and I would talk about it with my family too. Now that I started working here in the nursing home, and the first time that I dealt with someone who passed away, it was a blessing for me to be there to hold their hand and to make them as comfortable as possible. I feel I am not afraid to pass away anymore. I am more spiritually in touch I'm just not afraid of dying.
Right. I think that's, you accept death, more easily in a position like this, because you work with it so much. I mean, so you do accept it. I think the acceptance has gotten better with me.
And I guess I look at it as not just the way I view death. It's life itself. When I take a look at what I've really have learned from these patients and their families, I mean, it's more than just caregiving. They're sharing a lot of their life with me, and I've learned a little bit of something from everyone that I've cared for, be it good or bad, however I view it. And then I just take that knowledge, and I mean, we go through life continually learning, and we can still learn from someone who's dying and who's not, even at the point where they're not responsive anymore.
Right.
We learn, and then we pass that on to other people, and that's how I feel I've grown through caring with people, and I too am no longer afraid of death. But that kind of came along after my father had passed away. My fear was always that I wouldn't know anybody when I get to the other side. But now my dad's there, and my dogs, but now I have all these other extended family members, I call them.
And we also, we also try to remember, even when they're not responsive, that their hearing is still there, that they're still taking in all the things that you're saying, like you said, listening to the music or reading out of the Bible, and that they still do hear that.
Right. And while you're providing care,
right,
to not just go in there and talk conversation if you're doing something with somebody else in the room. That was a real hard part for me when I worked in a hospital setting, where it got to be too mechanical, where it was almost like you were just going in there to do to that patient, where in this kind of line of work we're doing for the patient, and we include them, which we should be doing in the hospitals, and other types of care also, but to let that person know that they're still here, and we appreciate them. And I mean, just down to the little things of, okay, I'm going to turn you now, or I'm going to do some oral care now, and just to let them know that we know that they're still there. It's very important.
I have told family members, go and talk to them. They hear you. You might not think
that they do.
They do hear you.
Great response, because a lot of them will sit there almost like holding the vigil, as like they're already in the funeral home.
Right.
They sit very quiet.
Right.
And a lot of times families will say, I don't want to wake them up. I'm afraid of waking them up, and I have to. And great, I'm so glad to hear that you feel comfortable going in and saying, just go ahead, talk to them, say what you want to say. You're not going to disturb them. That's wonderful. That shows that you've got a lot of comfort at where you're at, too, with your job. And you kind of touched on this question here. How has working with the dying patient changed your views, if any, on death and dying itself? And you had commented that you're no longer afraid of death. Do either of you have any feelings on that?
I think you appreciate life more. And you try to learn to live your life to the fullest and take it day by day and not get so stressed out about such little things in life, which we all do. I appreciate life. It's precious.
Right, living each day as if it were your last. I had commented to one of the nurses out there when I pulled in the parking lot. I just sat in my car for a little bit and just saw a woodpecker on the tree. And to me, I was just in awe, because these things go on around us every day.
Every day, right.
That we don't pay attention to. And that's one of the things that I'm very much for the patients I care for, is opening up the blinds in the morning and describing what it looks like outside. If they don't have the energy to open their eyes, they still can visualize in their brain. You can tell them it's a beautiful sunny day, or just describe what's out there, and it makes you appreciate, like you said, appreciate life that much more and take what you have and not take it so much for granted. Lastly, if you could, what kind of information or help could you give, helpful words of encouragement maybe, to new people coming new into this profession as healthcare assistants, anything positive to help get them through those rough times, like you had said, the first death?
I think that, I believe that a lot of what we talked about here today will help a lot of the new healthcare aides. But the first time that the new healthcare aide does experience a resident or a patient passing away, the way we won't be able to put their feelings in words. They will have to go through the experience, and how they deal with it will come within them.
Right. And don't be alone the first
Right.
time. Have somebody, more experienced go with you in that. And help you getting them all ready and everything else like that.
Great, great. Well, I appreciate all the information that you've shared and the stories that you've shared. Keep doing the great work that you're doing.
Thank you.
Thank you.
Thank you.